Hello everyone. So today we are going to learn about depression, okay, and its homeopathic approach. So first we should learn about depression. So what is depression? It is a group of conditions associated with the lowering of a person's mood and a loss of interest in activities, okay, like activities that the person is usually interested in, like hobbies or interest. Now he has no interest in them whatsoever suddenly. So causes of depression, there are many causes. So the first one is genetics. So how will we know depression is genetics? That it will mostly be early onset depression, like from a very young age. Then biological causes there, which includes monoamides or neurotransmitters, which we will learn now. Environmental cause, that includes death of a closed one or any significant death or abuse, etc. Okay. Then there is psychological depression, and also there are unknown causes for depression. So these are the causes of depression. Now monoamide, as you can see from the name, mono is one. Mono means one and amide is amine group. So neurotransmitter that have one amine group in them are serotonin or 5-HT, norepinephrine, and dopamine. So these three are the neurotransmitter that have one amine group in them. So they are called as monoamides, and they are responsible for depression, or they seem to be responsible for depression. So serotonin or 5-HT, it lowers in depression and is basically involved in obsessions or compulsions like your OCD. So serotonin is involved in that. Norepinephrine is involved in anxiety and attention. Dopamine, we have pleasure, attention, and motivation. So these are the causes of depression. Now coming to diagnosis. How will we diagnose the depression or clinical depression? So the criteria we use is from DSM-5. Now what is DSM-5? It is Diagnostic and Statistical Manual for Mental Disorders, 5th edition. Okay, Diagnostic and Statistical Manual for Mental Disorders, 5th edition, DSM-5. So the first criteria is 5 out of the following 9 symptoms. So here I am writing the 9 symptoms. If minimum 5 symptoms are present in patient, then he is suffering from clinical depression. The first one is depressed mood. Second is disinterest in pleasure. Third is weight gain or weight loss. Both are involved in depression. Fourth is inability to sleep, or it can be oversleeping. The person sleeps more than required. Then we have psychomotor agitation. And sixth is fatigue, tired all the time. Seventh is feeling of worthlessness, guilt. I have no worth. Okay, fear of done something wrong. Eighth is thoughts of death or suicide, constantly thinking about suicide. And last is low concentration. So these are the 9 symptoms. Second is significant distress to daily life. The person is unable to enjoy the daily activities in the life or the daily life. Then third one is symptoms must not be present due to substance abuse or medications or any other medical condition. So these symptoms should not be due to any other cause. There should be no cause for this, because depression, as you know, is a characteristic symptom of organic psychosis. Okay, so there should be no specific cause for these symptoms, then we can say that the patient is in depression. Now, after diagnosis, what we have is types of depression. Yes, there are four types of clinical depression. So the first one is postpartum depression. It specifies from the name itself that depression in a woman after the delivery of a baby. Okay, so you see the depression can also be before delivery or birth of child, so that is called as prepartum depression. Okay, now second type of depression is atypical depression. So in this, mood is improved. In atypical depression, the mood of the patient is improved when exposed to a positive event. Okay, so he is like sad and gloomy all day, and if one positive event happens and he is like slightly, his spirits are awakened, then he is suffering from atypical depression or mood reactivity. The third one is melancholic depression. This is opposite of atypical depression. The mood is so depressed or melancholic that patient is not happy even in the positive events. Okay, he is depressed and melancholic all the time. Nothing can make him happy. And the fourth one is the dysthymia. Okay, so this is persistent depressive disorder, which means depression from 2 years or even more. So as you know, Mark Ruffalo, the actor who plays the Hulk in Avengers movie, is suffering from or have been suffering from dysthymia since his childhood. Now, treatment of depression involves physical activity, very important. Okay, so minimum should be 20 minutes of physical activity 3 times a week. Second, we have a well balanced diet. What you put in your mouth is what is in your mind. Then third is psychotherapy. Obviously, the patients need to vent it out. And the fourth is homeopathic approach. We provide the best treatment for depression. Okay, now as you know, I don't recommend several medicines on the name of the disease. Okay, so you have to understand that only homeopathic approach is through totality of symptoms in every case. There is no other approach, but just for the sake of it, okay, many materia medicas, they tend to recommend these medicines for depression. The first one is obviously natrum muriaticum. So this medicine usually have these symptoms, then phosphoric acid, very depressive. Okay, and another medicine is ignatia. Okay, so but there are many more medicines for this. So this should be decided only after a thorough case taking and evaluation.